All right, well, good evening, everyone, and welcome to the sixth roundtable session in our second series of Challenging Discrimination Through Community Conversations. Tonight, our session is on ableism, accessibility, and advocacy in our community. We'd like to use this opportunity to thank the funder of this program, the Edmonton Community Foundation, who've made it possible for this program to continue this year. And again, we'd like to note that we do have live subtitles turned on. Please make sure they're turned on your side so they'll work. Yeah, so we'll just wait maybe a few more seconds and then we'll continue right along. Maybe we'll just continue right along. So we're gathered here today on the Miskwichi-Waskaikan traditional Treaty 6 territory of the First Nations and the Métis Nation of Alberta Zone 4. We respectfully acknowledge and thank the diverse Indigenous peoples whose ancestors' footsteps have marked this land for generations, including the Cree, Dene, Saulteaux, Nakota, Blackfoot, as well as the Métis and Inuit. This land is and has been a welcoming place for all peoples who come to Edmonton and call it home. It's a place built for community, trade, friendship, and shared understanding. We recognize those Indigenous peoples who are still fighting for equality today, and we support them in the spirit of decolonization and reconciliation. We remain committed to honoring the struggle of our Indigenous siblings and joining with them to end injustice. Together, we call upon all of our collective honored traditions and ancestors to help us work together in the spirit of community and understanding today and ever onward. So why do we do land acknowledgements? We are all treaty people. Long ago, when the first settlers came to this land, they drafted treaties that the Indigenous peoples signed in goodwill and in good faith. Those settlers and settlers up until today have not always honored those treaties. The treaties were meant to honor the traditional land and way of life of the Indigenous peoples, to ensure their rights and prosperity, and to build understanding and mutual cooperation. Today, we acknowledge the treaty land as a way to recommit to honoring the spirit of those treaties and to recognize the continued rights of Indigenous peoples as the traditional stewards of this land. We recognize that many Indigenous peoples have been, did I already say that? I apologize. So we acknowledge the treaty to understand that we each have a role to play as treaty people in reconciliation and to right the historical wrongs that have taken place. We would like to invite you to share your land acknowledgements based on the treaty areas you're residing in below, if you feel comfortable. So a little bit about us. Since our establishment in 1993, the Centre for Race and Culture, CFRAC, formerly known as the Northern Alberta Alliance on Race Relations, has brought together diverse people with an interest in promoting and supporting individual, collective, and systemic change to address discrimination and racism, and to encourage intercultural understanding. We take an intersectional approach, and our expertise spans workplace development, community building, research, and education. If you'd like to learn more about our current events, projects, and activities, please visit our website, cfrac.com, or you can sign up for our newsletter. So a little bit about this session. This session is a part of a new initiative titled Challenging Discrimination Through Community Conversations, an ongoing series of online moderated roundtables and webinars with guest speakers from diverse communities, organizations, academia, and the general public. We seek to understand and address experiences of discrimination and exclusion in the Canadian context. By shining the spotlight on different forms of discrimination, such as anti-Black racism, anti-Indigenous racism, and discrimination against Asian communities, amongst many other topics, we hope to encourage solidarity among groups and individuals interested in promoting social inclusion and equity. Now, our upcoming session after this for Black History Month will take place on February 23rd, 2022, from 5 to 6 p.m. We hope to see you there. We will just take 1 minute to collect some anonymous demographic data. You don't have to, but we appreciate it if you do. It tells us a little bit about you. So we'll just wait a moment to give you a chance to answer those questions. Awesome. Thank you all so much for answering these questions. I'll just give you a few more moments. Yeah, this is really helpful for us. All right, we're going to wrap up the poll in just 3 more seconds. Last chance. All right, thank you all so much. Next, I would like to introduce you to our speakers for this evening, starting with Cynthia Decore. Cynthia is an upcoming playwright and writer who combines poetics with critical disability theory in her unique perspective on chronic pain, grieving for health, and the experience of vulnerability. She is a member of the LGBTQ2S+ community, neurodivergent, chronically ill, and unapologetically bald. Online, Cynthia runs an Instagram account @DisabledDiscourse to articulate more of the nuances in everyday experiences of disability. There, she is self-described as chronically fatigued, flared, and foggy. And I would like to introduce you to Gomathi Boorada. Gomathi is the artistic director of the Shiva Manohari School of Performing Arts in Edmonton and is the recipient of the Edmonton Arts Council's Cultural Diversity Award. A Kuchipudi dancer who worked extensively in Southeast Asian dance, drama, and theater. In the past 11 years, Gomathi has worked at SSDM Alberta, a community theater in Edmonton, in the capacity of artistic director, dancer, and puppeteer, presenting shows and offering dance workshops in community schools. Gomathi is a member of the board of directors of CRISPY, an organization committed to fostering high-quality, creative, anti-oppressive, and inclusive art practices and performance. Gomathi works with the University of Gajah Mada in the capacity of guest lecturer, offering lectures, seminars, and workshops on Indian classical dances, dance and intercultural understanding, dance as ritual, and dance as cultural identity. Gomathi is a strong advocate in providing inclusive and integrated performance space for individuals and artists with disabilities. As a mom of a child with a severe speech and motor delay, she understands how difficult it is to find an inclusive environment for people with disabilities to be involved in the arts and theater. As a passionate dancer, puppeteer, and choreographer, she strives to give back to the community, which is often ignored or unnoticed. Gomathi provides interactive puppet workshops for children with disabilities and teaches them how to engage in social situations through role play with puppets, increasing their confidence, sense of identity, and language development through this play strategy. Next, I'd like to introduce you to our moderator for this evening. Our moderator is Zachary Weeks. Born and raised in Edmonton, Zachary has been featured in the media as a spokesperson on disability issues since he was 18. He has consulted on a variety of building developments, including the Glen Roses Bill Black Auditorium, the Walterdale Theatre, and Rogers Place. Zachary was a recipient of the Queen's Diamond Jubilee Medal in 2012 and is an alumnus of the Governor General's Canadian Leadership Conference. He was co-chair of the International Day of Persons with Disabilities Planning Committee in Edmonton from 2011 to 2014. He has been an active member of the City of Edmonton's Accessibility Advisory Committee, AAC, since 2013, serving as chair of the Community Engagement Committee until 2016, and then as chair of the AAC until 2019. His personal interests include cheering on the Edmonton Oilers and spending quality time with his wife and family. Lastly, we'd like to start with a couple of definitions just to help us along as we start this session. So ableism refers to bias, prejudice, and discrimination against people with disabilities. It hinges on the idea that people with disabilities are less valuable than non-disabled people. Next, there are 2 models of disability, the medical model and the social model. The medical model treats disability as a health condition. The social model views disability as a concept created by humans. However, this does not mean that impairments do not exist. Rather, the society a person lives in often informs what they think of as disability. And I'm going to hand it off to our moderator and our speakers for this evening. I thank you for your attention.
All right, well, thank you so much for the kind introduction, Serafina, and welcome to everyone here tonight. Hope you're keeping safe and healthy during these times. But yeah, I really look forward to the conversation tonight and learning from our guest speakers. And I really hope that we can get a little bit of dialogue going in the chat as well, because I see that there are some folks that definitely have some experience, either firsthand or indirectly with disability and the issues that we face as a community. So without further ado, let's get into the questions and have a great conversation. So I guess the first question is a rather big one. There's going to be a lot to unpack tonight, so hopefully we can do it in a way that everyone comes away with something tonight. But the first question for our guest speakers is, how are people with disabilities affected differently by our healthcare system? And I'll leave it up to you folks to decide who wants to tackle that one first.
I'll let Cynthia take it. I'll follow.
Okay.
Sure. I have notes here. I'm very ready. I think one of the things that we should really look at first and foremost is the ways that our healthcare system works as a carceral system, where accessing it requires a loss of autonomy, a loss of rights, a loss of control over what happens while you're in the system. So the more marginalized you are, the more at risk you are of certain types of prejudice that we've normalized or that the system might propagate even at the hands of the doctor, who might not be entirely versed in your intersection of identity. And it also gets more affected if you're isolated. So one of the things with chronic pain and something like mental health is, how do you access pain medication if you have a history of depression? Is the doctor going to use that as an excuse not to give you a pain medication because you might abuse it? So it does put you in a certain degree of vulnerability when you access healthcare. Healthcare also functions off of a cure model of disability, where it has to be erased or eradicated in order to be successful. It's not very versed in treatment, and a lot of it hinges on a formal diagnosis. So if you don't fit narrow criteria for a diagnosis, there's a lot of resources that you aren't able to access and a lot of treatment options that you can't access. I can keep going. I'm not sure how much.
No, I mean, that's a great start to answer that question. A lot of different points to bring up are things that I personally experienced as an individual with a disability, and I guess the biggest one for me is the loss of autonomy, and often, you know, every time I've had to go into, you know, the healthcare system, although I don't think we ever really leave it, if we're being honest, but you know, I feel that I'm the expert of my disability. I'm the one that lives with it day in, day out, with all due respect to the medical professionals. Don't get me wrong, there's some really great ones out there, but yeah, I totally agree with your points there, Cynthia, and I'd love to hear Gomathi's comments on this as well, having a son with a disability, and maybe being a little bit more fresh to the healthcare system, as I've been rather fortunate to not be in it for a while.
My experience with healthcare system, especially in Canada for the past 23 years, has been great. But when I gave birth to a son with disabilities, the whole scenario changed, because the system is used to treating able people. The doctors are trained to treat able people. So what about a person with disability? For my son, simply, it is so simple as speech. There is a delay in speech, so I take him to an optometrist to get his eyes checked.
Mhm.
They don't have a tool to assess him unless he speaks. So how do I have his eyes examined? As simple as that. And if you take the scenario of COVID, everything is online and you'll have to get all your information online. What about a child that cannot read? What
Mhm.
about a person that cannot access that service because he's not able to read? How do they access it? That is the first line. And the next thing I see is the healthcare system is trained to treat people on a general diagnosis that they have learned in schools. But then you have diverse variety of people coming from different countries with different diseases, different ways of approach. How do you reach them? It can only happen via representation of these professionals from those communities who can actually diagnose, because they have the knowledge of how this could be done from different countries.
Mhm.
And then also having that communication. The basic thing is communication, reaching these smaller communities where you could have a dialogue and find out how they can help, because they already come with stigmas that disable them to seek help. To have a
Mhm.
child with disabilities in your community, you have the stigma that no, I can't let this come out. So how do you break that? How do you make them comfortable that they can seek help? These are fundamental, even before we go into the systemic problems in the healthcare system.
Yeah, no, and I mean, it's funny we talk about stigma that we face in the society, but on this topic being healthcare, and then also breaking it down even closer to home, if you will. I mean, you have a variety of different uh, cultures and races involved. To your point of how do you accept and bring this out and be accepted within various cultures as well. I speak as, you know, a Canadian Caucasian male, but for other people it can be very difficult to accept um, disability and find pride in it. And I think what's ironic is that, you know, there's this healthcare system that's supposed to be there to help, and going back to your points, um, you know, it's ironic that these doctors also have stigmas of what disability is and what a person can achieve, I guess.
Yeah.
Um, so it's a lot of stigma, which I think brings us into our next question. If you're comfortable moving on, if not, I definitely don't want to uh, put a roadblock up in terms of the conversation. But Yeah,
I did a little bit more,
sure.
but before my first chronic illness, I was actually a nursing student. So I do know a little bit more about
Oh, wow.
how healthcare professionals are educated, and there is an arbitrary separation of healthcare professional and patient. And I think education systems are, I not just think, it's been proven in education and post-secondary are very inaccessible systems for disabled people to access. So healthcare workers are being trained in an environment without or limited in disability representation. And it doesn't include any critical disability theory, which would be the academic representation of disability instead of having peers or instructors who are disabled. There's no entertaining of the culture of disability. And it kind of just all reinforces that stigma and that cure model of disability.
Yeah.
I also think that because those things aren't addressed, stigma does have very significant impacts in how healthcare decides who gets organ transplants, who gets triage protocols are quite topical right now with the pandemic. There have been numerous news stories over the last couple of years about they had 2 patients who were crashing, so they saved the non-disabled patient because they assumed that that person had a better quality of life over the disabled person, strictly based off of the fact that the other person was disabled. So that stigma does have very real repercussions into whose life is worth saving and preserving.
Yeah. I mean, who's to say my worth less than what you believe another life is worth? And yeah, no, I mean, to your point about healthcare being inaccessible, not only is it hard to navigate systemically, but even physically. I mean, I've known people that have had to get basic healthcare procedures done, like a prostate exam in the back of a van, because they can't physically access their doctor's office. They don't have the proper medical equipment like lifts or that sort of thing. So I mean, yeah, tons of things
Yeah, there
to,
are clinics only accessible by stairs.
yeah.
Oh, sorry.
No, go ahead.
Oh, I was going to say, to pay for parking at a hospital, you can't reach the buttons from a wheelchair. And it really begs the question of who these spaces are designed for.
Yeah, and I mean, not just the physical aspect, but if anyone is experiencing motor delays or needs help with wayfinding, I mean, that in itself is difficult. And yeah, so I mean, why don't we for the sake of time move on to our second question, if you're willing, and that's sort of what we've already touched on, in that what is the societal stigma about disability, in your opinion? Maybe Gomathi, you want to start with this one?
Yes.
I think one of the big things to bring up.
A lot of things that are attached to the stigma because they don't understand what it is. I can just relate to people who think disabled individuals are not fully functional in a society. I would have people come and ask a child with Down syndrome and just assume that that child is not equally capable as the other able person in the room.
Mhm.
That is sure judgment because of ignorance.
Mhm.
Yeah, and some of the topics that you were talking about accessibility in the hospitals, and you know, I wanted to add to it. Yes, there are even this healthcare system, how they can provide services to people with disabilities is flawed. Most of their mechanisms inside the hospital are not made to support or to facilitate the person onto even the bed. You know, you
Mhm.
need people to actually lift you and do this. Those lifts are not provided, and that system does not exist. That's the basic that a healthcare system could provide for a person with disabilities. And I'm sure, you know, you said accessibility inside the facility to go find your way through. No, there is no access to that.
Mhm.
And yes, stigmas in the medical healthcare system itself. Somehow, you know, I remember my daughter saying that suddenly people would come to a 16-year-old and start talking like a baby. He's
Yeah.
16-year-old. He's You have to treat him as a 16-year and hear him out, right? It's a
Yeah.
stigma.
I mean, even myself and yeah, even myself over the years, and even I'm in my 30s now. They talk to you as if you don't have a brain,
Yes, yes,
and it's to your point on that front, and then also transferring into or onto beds or what have you. I mean, dignity
yes,
goes a long way, and it's totally thrown out as soon as you're in that situation where the proper supports that should be there are
yes.
virtually non-existent.
The dignity is the most important thing.
Mhm.
A dignity, even a 10-year-old or 15-year-old would like to be acknowledged.
Mhm.
When I take my child to a doctor's office, I want him to talk to the child and not to me. Acknowledge that he is a human being. Just because of his disability, he is not invisible.
Yep,
You,
absolutely.
yes, you need to talk to him. I think the healthcare system lacks that sort of training. Like Cynthia said, how many members of the disabled community are representing at that level of providing service? That is
Mhm.
very little. That starts with the accessibility of academics going into university and getting that education. That it is already flawed. You're not providing the right infrastructure for disabled people to reach those goals and get to those positions.
Mhm.
So obviously the service is already damaged.
So to that point, Cynthia, I know you had a comment about this question earlier, but I'd be really curious with your previous experience, sort of endeavoring into the nursing field. How can we move the needle in terms of getting people with disabilities in those positions to change the the stigma within and to help educate what would seem to be the most basic understandings of how to treat human beings. How can we move the needle? Oh,
I think it all kind of comes together with having critical disabilities, having those programs. I think if there were disabled professionals, there might be more accessibility in the hospital because disabled people wouldn't be assumed to be the patient in those settings.
Mhm.
I also think it all has to get done at the same time. If disabled people are working in the hospitals, they can advocate for accessibility in the workplace. It's hard to do any of these things singularly. I think it all has to be done collectively, and reimagining what health is would be very important, because I mean, right now we're living in a pandemic where health professionals are saying so many deaths a day with underlying health conditions, and we've normalized being disabled with it's okay that all of these deaths are disabled deaths. And that's coming from that medical model of disability that we would have to undo all at the same time.
Yeah,
Beautiful.
for sure.
That's fantastic. Yes.
Yeah, no, it's such a complex web of, how do we tackle such a big monstrosity of an issue that's been, embedded in our culture and across cultures for years. So yeah, I think, to those attending, I really see an opportunity there for advocacy of, if you're not directly impacted, it's okay to raise it forward, bring it forward. And even if you change one little thing, or even make things a bit more transparent for staff, that's gonna help individuals with disabilities immensely over time. So, and I think that really segues nicely into our next question. Sorry, of what acts can individuals do to help create change? Do you have any advice on how we can take what we're talking about today and sort of put it into action for meaningful change? Cynthia, why don't we start with you this time?
Sure. So I think really the benefit of there being so much work to do is that you can do a lot of things and all of it will help. Even something like anytime a politician posts about the impacts of the pandemic and forgets about disabled people, ask or correct them, add it in there. No, like cue politicians to remember that we exist. Politicians might, like, if they're involving disability content, ask them if they're hiring disabled experts or if it's just an unpaid consultant position. Question that. If a politician has accessibility in their platform, ask them what that means. Ask them who's their source of information. Kind of get that, because governments control like snow removal, road repairs, so many things that are very important to accessibility, and they work for us. So we should be asking them to care about this and to care about this community. And accessibility isn't just for disabled people, it's for women with strollers, or not parents with strollers. It's for a lot of people, and it benefits all of us. So it's not just a disability issue.
And to that point, real quick, before we jump over to Gomathi, it's not about you being disabled. It's when you're going to be disabled, because we're all going to get there, and some are just farther down the racetrack than others. So, Gomathi, what are your thoughts on how folks can team up and make create a voice for change?
I think taking individual responsibility, like Cynthia suggested, I hate to hear in the announcements that we hear about the pandemic that, you know, they had underlying conditions, but they are human beings too. The life is lost because of someone's inability to provide right resources to them. So I think we, as a community, everybody should question them and find them accountable and say, you know what, making those statements and somehow discounting the value of a disabled person's life is not acceptable.
No.
Do not make those announcements. That's when we find the administration, the governing bodies who take these decisions on behalf of us accountable. And that's where it has to start. And I also second that consultancy by disabled individuals. We have to be a part of that group representing, taking decisions, at least be able to provide our input, either as a volunteer. Yes, if we could do so many things for advocacy as volunteers by sparing our time, we could be representing on that board for taking right decisions. I think that representation is very important. And for everyone in the community, I would like to request, either a person has disability or not, to take that as their own personal agenda. That it's not about me, it's about the extended community that I have around. For example, we all took the vaccination, but one of the agendas there is save yourself and save your community. It's the same with disability. Provide these accessibilities to a disabled person. It's not about me anymore. It's a community that I live in and the individuals that are present in this community. So everybody has to be an advocate. I still remember the first day I held my son in my arms. The nurse that was present on that day said, "Mom, you're going to be his advocate," she said. Because he will not be able to do this. In the same way, I think the community has to take this onus of being the advocates for the people who are not able to do that for themselves.
Yeah, absolutely. And I think, you know, just thinking back on your comments as a mother, you know, and when I was born, it's kind of sad to see, because it tells me that we haven't moved forward enough as mankind, I guess, in that when I was born, the specialist walked in, and I was, you know, 6 months old at the time. He picked me up and he said to my mom, "Cute kid, but he has brain damage." And he set me down and walked away and on to the next patient. And so to your point, like, you know, I could just see my mother coming through on that comment, in that if that was my mom, she'd be saying, "No, I might be his advocate for now,
Yes,
but he's going to be his own advocate."
right.
And so, yeah, no, it's unfortunate that we still have so much work to do, but I think Cynthia had a great statement, and it was brought up in the chat by Sam, that the benefit of there being so much work to do is that you can do a lot of things and everything helps. And I think we'll take that statement and maybe launch into a bit of a Q&A with the remaining time, so we get a bit more to the conversation. For anyone in the audience or that's attending, if you have any questions, just pop them in the chat box. And just while we're waiting for that, I mean, we've talked about our community a lot. How can we make our communities accessible to everyone? And maybe we'll start with Gomathi on that for right now.
Accessibility should start with community consultation to find what we are lacking first so we can fill those voids. It has to start with gathering that information from the immediate community as to what are the requirements of this community. I don't remember the last time I received any information from the health services asking me, what do you need? Instead, I am given an agenda of things, what I could do. A neurologist looked at my son at University of U of A hospital while he was admitted. He was just doing his rounds. He came up to me and he said, Mom, I'm going to scan his head. There's a lot of fluid in here, but let me tell you, you'll have to look at the prospects of sending him to a school in Grand Prairie. 1, I didn't ask you. 2, my son is only a year and a half. You are already taking away his future or telling me what he's worth. But then after the scan, he didn't have the face to come in and tell me that was all brain. So where does it start? It starts that community consultation with every group, especially with the physicians and the healthcare system. They have to question themselves. Do we have the tools to assist these people with disabilities? I think that accountability should start from them. We have to do a complete review of this. And I think at least once, the healthcare system should reach out to people with disabilities and ask them what they need. I don't remember the last time they had sought any kind of input from people with disabilities. It's only thrown at them. This is what we could do, take it or leave it. No, that shouldn't be the system, because we are all as taxpayers paying into a healthcare system that promises that they would protect every single individual in this community. So I think if the change has to start, it has to start by community consultation.
Fabulous. Cynthia?
Yeah, that reminds me of a quote I really like. It says, "Help is only useful when it empowers," and I think that's kind of at the heart of that is charity is not helping. I think, but for communities being accessible too, I think even vaccinations and wearing masks are a point of accessibility right now. I mean, I'm immunocompromised. I haven't caught COVID yet, but if I do, I am at a very severe risk. So anyone doing their part, I am one of those people that has the underlying health conditions and I'm trying to stay alive. And I think even some like practical accessibility concerns would be adding accessibility information to a Google listing so someone can look up if they can even access the space before they go all the way there. Bring government to fix public transport so that it's actually functional for people with disabilities would be really great. There's a lot of things we can be doing, I think.
For sure, no, and I totally agree. I mean, it has to start with our community. as individuals with disabilities, or those that are directly impacted, I guess you could say, for lack of better words. That's family, friends, allies. And yeah, I think what's really important more than ever now is we cannot do it alone, and history has taught us that you can't do it alone in terms of every other big movement, whether it's Black rights or LGBTQ plus. It takes intersectionality to really move the needle and make it awkward, and I'm not saying go out and create a bunch of pandemonium, but let's form together as one, and be each other's voices when we don't have a voice. So yeah, I don't. Have we received any questions from those in attendance tonight? I don't see there being any right now, but one of the individuals in the audience, Sam, who I know quite well, is a fabulous advocate for people with disabilities. She says there's an initiative to push for accessibility legislation in Alberta, or for Alberta. AB and PEI are the only provinces that haven't even started this conversation. It won't fix everything, but it is another mechanism to work towards accessibility. And she would appreciate support outside of the disability community for this. And there's a website that is barrierfreeab.ca. So if anyone on the call wants to check it out after this, that'd be great. And I know I would certainly appreciate any support on my behalf as a person with a disability. Let me just see here. So Bobby made a comment in the Q&A saying there's been a lot of talk about diversity by Edmonton's new mayor, but no talk about how that goes beyond race. Quite frankly, as a white male with a disability, I feel quite left out. Well, yeah, I mean, to our conversation tonight, Bobby, it goes beyond race. It's a variety of different layers to the onion, so to speak. And I've been able to chat with Amarjeet, so he a bit about disability issues. I will say that he is a rather compassionate man. It's just a matter of us staying in the politician's face, right? And keep hammering home examples. So there's another question in the chat about from Farah. Is there a country that has a great plan that we could try to model? How about any suggestions, Cynthia or Gomathi?
I have something to talk about the European system of healthcare. Especially my first-hand experience, my daughter moved from Canada to Scotland. And this is what she said. She said, Mom, it is a free healthcare system, but it seems in the first month that she stayed there, she received a huge list of questionnaire as to what her requirements were. A personalized letter to her asking what her requirements are. I think that's a good start to find out what are the requirements of this community. And I also would like to acknowledge that question about Amarjit Sohi being the mayor and addressing everything else, but not disability. Yes, I would like to see mayors who promise to provide for the diverse groups in the community to kind of call the disability groups and firsthand talk to them, start that conversation with them. That would be great. Yes.
Absolutely. And I can say that I had the pleasure of working with Amarjit on a previous campaign called Cheerleaders, where he actually spent a day rather, in a wheelchair, albeit, it scratches the surface, but it certainly opened his eyes mighty quick as to what was a challenge. Real quick, there's another question in the chat from Joyce, who says, apart from information on chat, are there any other organizations or support groups? So I guess that's in relation to disability organizations or support groups to help forward the message.
There is Hold My Hand. I could talk for children because that's where my advocacy is. Hold My Hand is an amazing group of parents and professionals from the community providing support for neurodiverse children and also children with disabilities. I think that's something to follow too.
Absolutely. And Cynthia, do you have any recommendations for disability organizations?
I do think there's definitely more resources for children with disabilities than there tend to be for adults, which is its own problem. But social media does function in that role a lot of the time. There's a lot of advocates online who can, disability representation in social media is a great way to educate yourself and to find community and build it from there. There's been some meetups, I think, for people with chronic illnesses around the city, but they are few and far between because they're usually organized by someone who's also on limited energy and resources. So it's a little bit tricky.
For sure. In terms of, my experience as a person with a disability, I tend to agree with you, Cynthia, that, after you hit that age 18 moment, I guess, seems like everything around you sort of disappears in terms of supports. And that in itself is an issue. I do see that Serafina said that we will send a follow-up email to everyone attending tonight, and it'll include websites for these organizations. And one of the big ones that I'm involved with is the City of Edmonton's Accessibility Advisory Committee, which advises City Council on disability issues. So if we can include that as well, Serafina, that would be great, maybe one last question because we're approaching 6 o'clock, but and I think this is a great way to end as well. It's from Karen, who says, can you speak a bit about respectful language around disability or recommend a good resource for learning more? Do you want to take first crack at this, Cynthia?
Sure. I think you can definitely look on Google about ableist language to get a general idea of what that entails. Disability advocates love to come up with new versions of phrases like to excuse ableist language, blind leading the blind would be one. I really like a dog walking itself as an alternative. It has a little bit of that playful energy, but it doesn't use disability as a metaphor. Using disability as an insult is definitely, and a lot of it is very naturalized in English. But I think that's a good place to start, and use the language that people use for themselves and be open to being flexible. Kind of like what we were discussing earlier about identity versus person first language. If somebody has a preference for themselves, let them.
Absolutely. Gomathi.
Cynthia covered most of the points that I want to say, so not much to add to that. She did it beautifully.
For sure.
Thank you.
And what I will add to that is like, and I know it takes courage, but at the end of the day, if you're unsure, just ask. In my opinion, I mean, you know, like just like nowadays with pronouns and whatnot, just ask. And you know, I find that people will be more offended if you don't ask than if you do. So, and one last comment, I think, to set things off into the sunset, if we will, is a comment from Joyce that says, I think it's more appropriate to be called ability rather than disability. And I think that's a really strong theme for tonight. But also being cognizant that it's okay to admit that you do have a disability. And yeah, so thank you to everyone who attended. I'm gonna hand it off to Serafina. And yeah.
Thank you all so much for attending this evening. I would like to thank our speakers, Cynthia Decore and Gomathi Boorada, and of course our wonderful moderator, Zachary Weeks. And in the chat, we just have a super quick Google survey to ask you about your experience in our roundtable. We would love it if you would take a few minutes just to answer that. And we hope to see you again soon. Thank you, everyone.
Thank you.
Thank you.